Hello and welcome to BORNO Health Update. My name is Ibrahim Amarawa. Health Update, as you are aware, is a program designed to update you on Governor Zulum's transformation drive in the healthcare sector under the leadership of Professor Baba Malumgana, the Commissioner of Health and Human Services, Borno State. As is widely known, northern Nigeria is leading globally in maternal mortality issues, with the Borno State being among the affected areas. Therefore, the Borno State government has launched a pre-maternal health services program, including cesarean section, to completely eradicate this problem. To assess the impact of this pre-maternal service and cesarean section initiative, the Borno Health Update team visited the state specialist hospital. We began by engaging the medical director of the hospital, Dr. Baba Shehu Muhammad, on how the program is being implemented.
Actually, pre-maternal services has come to stay, especially courtesy of Borno State government. It came in when the state actually needed it because of the economic crunch. Most of our people are indigent, and now the executive governor of Borno State, in his wise wisdom, decided to bring about the free maternal services. So I think it started about 2 years ago. All maternal services were made free throughout the state, not only in state specialist hospital. He inaugurated a committee and launched that particular program. Thereafter, everything kick-started in earnest. So starting from antenatal drugs, investigations, then where there is need for cesarean section, that's operation, it was also free. Then the normal spontaneous vaginal delivery was also free. Then up to 6 weeks after delivery, all medical services that are needed are also rendered free. So it's a huge program. And now, even physically, whoever that comes along into the hospital will discover that all things are being made free. So he will now, there's this cascade effect. Before you know it, he will now inform others in his own environment. Then I think the Bulamas, DCHs, and so on, the traditional rulers were also involved. So they all mobilized. So that was why you see all the hospitals where maternity services are being rendered, you see them coming in drones. Unlike in the previous years, where the services are being shown away, you see many more home deliveries with so much complications. So that has reduced. And mind you, Borno State has been earmarked as one of the worst hits by maternal and child mortality throughout the federation. I think we're the third. And Nigeria is the worst hit country throughout the world. So for that reason, I think the government came along with this particular program, and it was quite revealing that it has reduced to some extent the maternal mortality, and the impact is quite enormous. I'm sure you must have gone around to hear from those beneficiaries. It's quite impactful. And looking at this particular successful program, the federal government has also launched free cesarean section for indigent individuals that have complications. So that will not shy away, or should I say, shun away the free maternal that is ongoing within the state, because theirs has to be with complication. This one, everybody that has conceived must be taken care of to reduce maternal mortality.
All right.
Our medical and social welfare department is also part of it. I think this is one program that has encompassed almost all cadre of staff that we have. So the eligibility criteria is the pregnancy. Once a woman is pregnant and she is accessing the facility, then she will not enjoy no discrimination. Based on what the government said, no discrimination, in order to encourage more women to come alone. Those that have wherewithal, I think they go to private hospitals and elsewhere. But for those that need it, you will see them coming. And even the patronage has tripled, or if not quadrupled. The patronage has quite grown to the extent that the department that has the most doctors here, I think obstetrics and gynecology has the highest number of doctors within the hospital, because there's an ongoing residency training program. So, and whatever it is that they're doing, it has to be the best practices. So people are encouraged and are impressed by the services. They compared services with other sister organizations and private. They discovered that it is one of the best. So you see them coming, and from your interaction too, you may have discovered that some of the women that have already patronized other places, now they are here. You hear stories that actually, if they had known, all along they would have come to State Special Hospital for their medical services.
Dr. Zara Omache is the CMAC of the State Specialist Hospital. Explain how the hospital is working assiduously to ensure the success of the program and that the intended beneficiaries are receiving the necessary care.
And the free maternal services include both the antenatal care services, which include seeing the patient is free. The booking cards are also free. All the investigations are free. Then the drugs at the end of the antenatal clinic is also free. The laboratory, the ultrasound scan is not free. The ultrasound scan report is not free. Then if the woman comes in labor, we admit the woman and then we render services. If she delivered vaginally without any problem, fine, we discharge her. If she has complication, we also have, and the state government also provided free emergency services. So the cesarean section are also free. Then even the admission in postnatal ward, they are also free. No, everybody is entitled, because there was no criteria that was given to us by the state government. The only thing that is not completely free is the blood transfusion. If you come, you have to get donors to replace the blood, and sometimes the blood bank, the blood bag, the bag is also, you have to go and buy it. It's not free. Screening, when they have free reagent, is also free, but when it is out of stock, before, sometimes we have some lapses before getting it to the facility from the medical store. When there are lapses, we cannot just wait and ask the woman to wait for the free maternal to be available, but we usually make sure that when it is getting exhausted, we provide. And sometimes when it is available, or if we see that the woman cannot provide, sometimes we also give charity. We just help the women.
That was Dr. Zara, CMAC of the State Specialist Hospital. Moving forward, the head of the pharmacy department at the State Specialist Hospital provided an overview of the type of drugs and medical consumables covered under the prematernal service. He also praised Governor Babagana Umar Zulum for providing this support to the people. Let's hear from her.
Professor Babagana Umar Zulum launched the first free maternal program in the state. I was opportuned to be in attendance. It took place at the Central Medical Store of the state around Harawa. And then His Excellency promised women in the state, women resident in the state, free maternal services from conception to 2 weeks post-delivery. So from conception, there are routine drugs for antenatal, Then any infection that may happen to them during the period of pregnancies, the commodities and drugs were provided to take care of them. And then during delivery, whether it is normal vaginal delivery or complicated deliveries like cesarean section, everything would be done free. That was the declaration of His Excellency. And I can say from that time up till today, we are still running the free maternal program in this facility. Yes, so any woman that comes here from antenatal, we give their routine drugs. In the label pharmacy has been free. Everything in the pharmacy is given free to the clients or patients when they come to the facility. It's all drugs needed by the patients from pregnancy to delivery and even 2 weeks post delivery. You know, during the antenatals, that's for a woman that doesn't have any complication. She's supposed to be on routine drugs that we call hematinics to boost her her blood and then that of the health of her baby. We use ferrous sulfate containing preparations, either in a tablet form or a capsule containing other multivitamins, the folic acid, the calcium lactate tablet, and then the antimalarial sulfadoxine pyrimethamine that is given at certain period during the pregnancies. That is for antenatal. Then during delivery, during delivery, we use trust pad, we use the jig, we use the underpad. That is for normal vaginal delivery. And then we use, in some cases, infusions, either normal saline, Ringer's lactate, dextrose saline, as the case may be. That one is to be prescribed by the physicians. Then consumables like plaster, drip giving set, cannula, cord clamp for the baby, and the rest are also part of the drugs, part of the commodities and drugs provided. Then antibiotics like ceftriaxone, azithromycin, as the case may be, metronidazole infusion, and the rest. Amoxicillin capsule, amoxicillin clavulanic acid tablets, and even hypertensive drugs, antihypertensives. That's drugs for hypertension, because hypertension is one of the conditions that can happen as a result of pregnancies. So we have methyldopa 250 milligram, amlodipine, lisinopril. They have all been provided by the Excellency from time to time. Presently, they are still on in the program, thanks to the governor of the state. Once a woman enrolls for the antenatal care in this hospital, she is informed that her treatment is going to be free. If we go to the antenatal clinic today, you would see we have a register. I don't know, a copy is right behind you. If I can show you, that is where we record everything we give the woman. If she comes for antenatal, we take her name and her address. If she has a phone, we take her phone number, and then we document the drugs given to her, so that in case in the future, if the governor of anybody comes for the purpose of verification, they can just pick the phone, and if they call the number, if the number is going on, if the number goes through, they can ask the woman, did you visit so facility within so time? They gave you services, yes, or you delivered there, yes, okay. Did they charge you? Did they give you drugs free? It can be confirmed.
The medical director and other officials of the State Specialist Hospital commended Governor Babagana Umar Zulum for introducing this prematernal services as a registration program, which has helped save lives, especially among low-income families facing difficulties during childbirth.
Cannot actually quantify or explain by words. That is what Prof is doing. His Excellency, when he came on board, I think you've heard what happened in Omar Show when he went there late at night. So he does his monitoring by himself. He never allowed anybody to do it. Now that we are not seeing him, it doesn't mean that he's not around. He has so many eyes, so many ears. So the slightest inch of movement that happens, he knows about those ones. So his style is good. That means he is in touch with these people. He's closer to them the way he's doing. we're always on our toes to make sure things work very well. So those of us that enjoy this kind of work, I think we are finding it very easy and accelerating for us to undergo through this type of leadership. And that is why when the Honorable Commissioner came on board, he brought this issue of clinical governance, which is worldwide a cutting-edge program that actually takes care of all the loopholes. So clinical governance has come to stay, courtesy of Honorable Commissioner, with support from the governor. The governor is always supporting all their needs. That's why you see them writing, or any of their requests is being addressed squarely by His Excellency. In fact, at times, he even reminds them that there are things that he needs to do. This coming up with these free services. You've heard about free eye surgeries that took place, which is courtesy of the state government. And in fact, he didn't do that. He also reimbursed, or should I say, incentivized all the patients that had undergone those operations. No, the payment was waived, no, but they also collected some things. Here too, free maternal services. All women that came into state hospital, they enjoy the services. You need to come and see our antenatal clinic day. It's always jam-packed. In fact, we have to do several sessions in order to cater for the people. And the government too is not relenting. Initial procurement of those drugs were judicially utilized, and from there they now made apart from the first need assessment. So there was another need assessment. Why was the second need assessment? Because of the influx. It has almost quadrupled. So that now necessitated the government to now increase its procurement of those consumables. I think it's quite impactful.
Thank you. And lastly,
I think we enjoyed more. As you can see throughout the hospital, we have a Starlink. This is it. We can actually link it up. So throughout the hospital, we have this Starlink that has come to stay. And this has greatly impacted on the residency training program that is ongoing. All undergraduate doctors that have already gotten their MBBS that want to further their education in various departments have now started doing so in this particular hospital. So obstetrics and gynecology have their own accreditation by West African College of Surgeons, and re-accreditation was also carried out just last 2 weeks. And from all indications, we've gotten it because of the support. It involves huge amount of resources, financial, infrastructure, and human resources. Everything is part of it. And the government has supported all through the Chief Medical Director, Honorable Commissioner of Health, and then even the governor himself.
It's a very good strategy that was initiated by the state government, because earlier on we were having a lot of challenges. Women will come accompanied by elders, an elderly woman, the husband is not available. If you ask the woman, get something, she will tell you that she only has 50 naira. And 50 naira now, even a child cannot, if you give a child 50 naira, he may not even appreciate that money. But now, when they know that at the facility it's only blood, that we now ask them to go and get their relative, because there's no shop for, you have to bring the blood, is blood bank. So you have to come and donate, you deposit, and then another person gets the blood. So they come, they avail themselves to the hospital, and this one also reduces, this one has also reduced the delay in offering our services, and by so doing, reduction in maternal and perinatal mortality and morbidities.
I've worked with Borno State government for like 10 years now. I would say in my 10 years of service, what happened before I came on board, I wouldn't know. But I would say in my 10 years of service, Professor Babagana Umara Zulum is the first governor that I had a one-on-one town hall meeting with. There was a time he visited this facility and he called all the HODs and had a meeting with us. to listen to our problems. If you move around the hospital, you see a new building being erected. That was one of the promises he made in that town hall meeting, and you can see him fulfilling it. Since I came on board, CS, antenatal, everything has been paid for by the family. And sometimes you will see a woman, she would come crying. The staff would have to dip their hands in their pockets sometimes and sort her out. If not, she may not be able to afford delivery. But now it is free maternal services. It's not something cheap. And I will say thank you, Your Excellency. I am a woman. Let me be a bit sentimental. Thank you so much for coming to the aid of the women in Borno State. We are grateful, Your Excellency. Digitization, even the Borno State Drug Management Agency, it came to limelight when the Commissioner, His Excellency, Professor Babagana Malim, came on board. And I can say it has solved a great deal of our out of stockage for drugs and consumables in the state. And as you can see, this brand new computer is courtesy His Excellency's Professor Baba Malim's initiative of computerizing the health facilities so that it will help us to serve our patients better. Records will be kept, it will be lost, and I think we are happy and we are grateful.
We thank God for the intervention. The issue of a free maternal service has been impactful. There's no doubt about it. Many of our patients do come. Some come at emergency points without having the financial capability for some of the emergency procedures that may be required. And because of the intervention of the free maternal services, we see that some of them do even undergo some theater procedures without even paying a penny. That saves their life first. Apart from that, it also saves the life of their, some of them become pregnant. So we also make sure that so those timely interventions are not something one can actually monetize. But because of the fact that there's somebody, the government is paying the bills behind the scenes, it makes some of these operations seamless.
Additionally, beneficiaries of the program whom we spoke with expressed deep gratitude to Governor Zulum and the Commissioner of Health, Professor Baba Malam Gana.
ala shakwalzi ala farmaida kalar siwal tisiri shura gulte ba shura askarena don na diro chondi aiso andiro diro choro liulaso dripso sama andiro diro choro awro yana mabaw apima yana mabasoro.
Sunana Maryamu Bitrus, ina kulallori da Buwarot. To abinda aka yi ma jama'a mu ma mun dandana mun gode. Ma gwamna Zulum muna ce mishi mun gode. Abinda ana yi da kuɗi mu kyauta muka samu. To muna ce mishi mun gode Allah ya saka da alheri. Gwamna Zulum ya mana CS kyauta. To kaga dole mu ce mishi mun gode Allah ya ɗaukaka shi. Le ba shi abin da yake nema.
Sunana Hauwa Ismail. Gaskiya alhamdulillah da muka zo mun samu kula sosai gaskiya. Kuma gani ma mun samu na kyauta alhamdulillah mun gode Allah ya saka da alkhairi. Mun samu kulawa sosai Allah ya biya.
Sunana Fatima Yahaya. Aikin da aka yi min a asibiti sai dai in ce na gode gaskiya. Dan tiyata na 4 a asibiti 2 ne kawai na biya. Da wannan da na last ɗin duk kyauta. Da magunguna da komai kyauta gaskiya sai dai ba abin da zamu ce dai mu gode. Magunguna su drip syringe komai ka nema kyauta gaskiya. Komai ka nema dai in dai na fannin lafiyan ka ne kan kyauta ne zaka je ka karba. Gaskiya mun gode.
Sunana Fatima Ali. Asibiti tiyata aka kawo ni. Kuma alhamdulillah kyauta aka yi mu. Na gode sosai da gwamnan na Allah ya saka da alkhairi.
That was the beneficiaries of the prematernal services in Borno State. It's a great initiative that has made a great impact on the lives of the people. Well, viewers, with this, we have come to the end of this week's edition of Borno Health Updates. We hope you enjoy the program. Join us next week for another interesting segment. Until then, I am Ibrahim Amarawa saying bye for now.